Hi, Dr. Neha Gaur. So nice to have you today in this session. And I'm really looking forward to all the insights and knowledge that you have to share with the students.
Thank you so much, Dr. Ichita, for having me. It is always a great honor for me to connect with fellow prosthodontists, and especially somebody like you who has been through a similar residency journey just like me. So let's see how it goes. Yeah.
So you have yourself helped me so much in my residency journey. So I'm really looking forward to what messages you have to give to the students who will be obviously benefited a lot. So, ma'am, how did you navigate your career past the MDS journey? Because I have also graduated, and even like me, there are so many other graduates who feel the confusion and the doubts as if to how to proceed about this. So, do you have anything to help us out with?
So basically, if I talk about myself, deciding a career path wasn't really a decision that I made after my MDS. That must be for the many of you. But it was very clear for me right from my BDS date, and I had a very strong vision of what I or where I see myself in the next, say, 10, 5 or 15 years or whatsoever. So that having that clarity is very important because after MDS, there are so many avenues for you to explore, like be it academics, be it private practice, or be or working in a clinical setup, be it corporate or private only. So having that clarity sorts a lot of things. Also, I did sought advice from a lot of my seniors, my peers, my even my mentors and all. But it is very important to understand the fact that what worked from somebody else, it is not necessary that it will also work for me. So having that also in mind really help you to navigate your path further. And also that's the reason I strongly believe in that you need to carve your own niche or don't follow anybody's path blindly that somebody did that, so I should also follow and do that at that. So things like that. So the main challenges that I faced was that as soon as you are a fresh graduate and you are a fresh graduate and you just passed out from your college, so the biggest challenges is that there is a vast imbalance between the supply and the demand in the market in terms of job. So there are too many specialists who are coming out of the college and who are already there probably in the market, and they are all competing for so many too few quality opportunities actually. So say be it government SR-ships or private sector also. If I talk about SR-ships also, there are hardly one or two seats at the max, and it is not even necessary say that it will be there for your particular specialty at given point of view. So that's pretty unfair, right? And given the fact that there is reservation and there is so much cutthroat competition, it becomes very difficult. So I know a lot of people who are overworked but are underpaid. So that is also one of the challenge that I faced. And in the beginning, you feel that you kind of get tempted to take up any opportunity just to gain the experience, but I constantly reminded myself the fact that I have the skills, I know the work that I do, and I have full faith in what I do. So I refuse to work for free or to settle for less. So that is definitely I would want my juniors to take away from me, say. And another challenge was that when you enter the real world, say after MDS, so the transition is something which you need to cope up with. Say when we are in MDS, we are in our PG, so we have a lot of time to discuss a particular case. There are a lot of discussions with our mentors or teachers or with our co-PGs. But in private practice, you have to be very quick. The decision making, the treatment plan, and at the same point of time, communicating rightly with the patient is also very important. So these are all the challenges that you face when you enter the market, and then you carve your path through it. So yeah.
Okay, ma'am, I could literally see myself in the answers that you were giving. So this is what I am going through in my journey, and I was like, yes, yes, exactly. This is what happens. So
What happens?
Yeah, that was really good advice you gave, that, not to settle for less. Because I think this is something that the fresh graduates, they really get tempted to do, because somewhere people make us feel that, you're not good enough, or you're just a fresher and you should work for free, or you should work for like a minimum cost, or they just pay you peanuts for that. But yes, that gave me some confidence, and I'm sure it will give people who are watching this video some confidence that yes, they can still establish themselves just after freshly graduating from their colleges.
Yeah, see, patience is the key. So if like even if it takes some time, just be relaxed about it. There's no hurry, right? You need to wait for the right opportunity to click.
Right, ma'am. Absolutely. So, Dr. Neha, there are a lot of BDS students, and I would also say MDS students, who somewhere feel that prostho is such a difficult subject and it's impossible to conquer it. So, there is this thing called prosthophobia, something that even I had when I was a BDS student. So, now you have gone through the journey of prosthodontics, you've completed your MDS, you're practicing now. So I'm sure you are at better terms with Prostho now. And is there something that you would like to share with the budding dentists that would make their journey with prosthodontics a bit better?
Yeah. So, firstly, I would like to say that claustrophobia isn't a myth, it's very real. And I personally had it for the longest time of my life throughout my UG and even during the first year of my residency itself. So, I absolutely dreaded border molding, and my co PG will agree with that. And anything prostho related felt really overwhelmed. But before jumping into the solutions or why this happens, it's very important to understand how it started. So for me, it was something that it started right from the UG. So there was a lack of proper guidance in my UG days, or probably a lack of interest also. So if your undergraduate training is something which is weak, and it's natural to feel lost sometimes, and when you start working on the actual patients, and also the anxiety of getting it wrong, this probably varies from different person to person, but yes, I do have that, and I still have that. I do get a little anxious when I start, I do new things or try new things. So for Prostho particularly, whether say it's a bad impression or an incorrect occlusion or an ill-fitting prosthesis, say you did your trial well, in this complete denture case, the trial appointment was absolutely fine, but you did your processing of the denture, and when the patient comes in for the final insertion and there is a open bite there. So yeah, I used to get anxious about all those things, and definitely the fear of repeat or the follow-up appointments was something I used to be scared of. So probably that was the main prostrophobia for me. So if you're also somebody who is struggling with prostho, see, you are not alone. Me, Dr. Ichita have all been there, I'm sure. And let me tell you that the prostrophobia is very much conquerable. And once you break past the initial fear, it's it's a wonderful branch. I must tell you. And so overcome this, I change few things, and I recommend the same to everybody. Three golden rules: practice, practice, and practice. So there is no shortcut to overcome this phobia. I repeat, none. All you have to do is to practice repeatedly, one after another. Okay. And what I did in my residency was that I used to love observing and learning. And by observing, that doesn't mean I used to just watch my colleagues or my mentors or even my juniors do the work. I never used to just see. I used to understand what they are doing and why they are doing it. So that why thing is very important to, get past that fear. And of course, experience is the best teacher for everybody. And the more cases you handle, the more confident you get. And also, as a BDS or as an undergraduate student, it's very important to clear your basics right from the starting. Read your standard textbooks, and most importantly, whatever mistakes that you are doing in your clinical practice, just go back to your rooms, get back to your hostel rooms, and just open your books and go through the text. What exactly is the error? Why is it happening? What's the exact rationale behind it? So, unless you understand the rationale or the science or the logic behind it, it becomes very difficult to, actually overcome all those mistakes. And then you need to learn how to troubleshoot and not to panic if any situation of any that thing like that happens. And what else? Yeah, smart work over hard work. I'm an ardent follower of the this belief that instead of doing hard work, I like to do smart work. Like, how do I explain? Like what works for you, instead of blindly following the traditional concepts, try to do things differently. Say, I never liked doing body molding, but in PG, I started, learning new techniques, new materials, or how I can improvise my body molding techniques. I used to see other people doing it, and everybody has their way of even heating the green stick also. So that's just the smart way of doing it, instead of just doing hard work and putting in lots and lots of hour and doing just one thing at a time and still not getting the exact or the accurate things. So yeah, these are the things that you need to take care of to take away the prosthephobia away.
Okay, ma'am. So I think you have given so many points that I think prostrophobia terminology should be eliminated from the dictionary now. So I really love the way how you
Must.
emphasized on going to your basics and reading standard textbooks. I mean, it is something that even I faced when I was doing PG, like when I started doing cases and I started practicing more, I started reading standard textbooks. That was the point when I realized that, Arey, this is so easy, and I used to feel scared with this. So so I think this is the story with everybody who has conquered their prostrophobia, and to all the undergrad students now, you know what to do. So, Dr. Neha, if someone wants to pursue prosthodontics as their career, so what is the scope for it in India and internationally, globally? So, what are the opportunities that you can get being a prosthodontist?
Oh, so the scope of prosthodontics, it's tremendous. With so many advancements in technology and say increased patient awareness, the future is full of exciting opportunities for all of us. So if I particularly talk about India, say dental implants are here to stay, okay? Be it conventional, zygomatic, pterygoid, they are no longer in the future. They are right here and everybody is doing it, okay? But while almost every specialty is venturing into implantology, prosthetically driven implant dentistry is something which is the key for a successful treatment outcome, right? So only a prosthodontist can understand the implant prosthesis or the prosthetic part of it in a better way than any other dentist specialty. Okay, and then if I talk about maxillofacial prosthodontist, it is increasing. The demand is increasing in terms of not just the rehabilitation of the cancer or the oncologic patients, but it is also expanding its avenues in, say, congenital anomalies like cleft palate, ectodermal dysplasias, and even for the trauma cases and all. Okay, so Tata Memorial Institute in Bombay as well as in Varanasi is offering observerships, scholarships, and even SRships for maxillofacial prosthodontists in India. And even there is a sub branch of Tata Memorial, and they have opened their new center in as Homi Bhabha Center in New Chandigarh also. So they are also offering such SRships also for maxillofacial prosthodontics. And also there is Enhance program by Dr. B. Srinivasan. It is also affiliated to an international body by the name of ISMR. It is an international society of maxillofacial rehabilitation. So that is also a very promising thing to proceed if anybody has an interest going for maxillofacial prosthodontics. And then there is an emerging niche for temporomandibular joint disorders and even sleep apneas, and there are fellowships provided by Smile USA under the able guidance of Dr. Shankar Iyer and his team. And nowadays, if I talk about the labs also, they are fully digital. And there are so many prosthodontists who are having their own private practice, or even if they are working in any private setup, they have started their own high-end labs also. So if a prosthodontist is opening a lab per se, so I can't even imagine. You must imagine the accuracy or precision they must be incorporating in all those prostheses, which are the supervision that their technicians are getting being supervised by a prosthodontist themselves. So yeah, that is also one of the avenues that people are doing these days. And lastly, if I talk about cosmetology and dentistry, so they are also merging these days, and especially for beauty pageant contestants, celebrities, all these influencers. The Prostho offers a beautiful blend of cosmetology as well as in terms of function as well as aesthetics. So yeah, the most common examples are gummy smile correction if I'm doing a veneer case and if the patient has a high smile line. So if I'm putting a little bit of lip fillers or a little bit of Botox here and there, so I can also take care of those things. So yes, on a global platform, if I talk about Prostho has a higher demand as compared to India, because unlike India, the prosthetic work there is absolutely and solely done by the prosthodontist. So you definitely have better job opportunities and higher pay opportunities. And of course, there are many fellowships and short courses and specialization programs that are happening all around USA, Canada, UK, Australia, and even in Germany and all. And there are board certifications as well. For example, there is American Board of Prosthodontists. You must have heard about it, which also adds a lot of credibility to your name, and it opens a lot of international avenues for you as well. And if I talk about in terms of research work, countries like USA, Germany, and even UK and Japan also, they invest heavily in dental research. So universities and private companies offer grants and scholarships for research in the areas like biomedical or biomaterials, or even for the prosthetic AI-driven prosthetic designs and all. So yes, prosthodontists do have a scope over there in the research field as well. So yeah, that's all about it.
Well, that's like a lot, and even I did not know that
I
Prostho
don't
has so much scope.
know. Yeah, yeah.
Yeah,
So,
I really like the way how you mentioned even the programs, fellowship programs, and you took names of a few institutions so people take a note. And so the beauty of prosthodontics is that there is so much scope in it. I mean, the basic prostho can be divided into 5 subjects, and every sub branch has it's like a own world out there. So thank you for listing out all the scope and the prospects of prostho. So, Dr. Neha, moving to the next question, that I feel that there are a set of mistakes that most of the people commonly make when it comes to prostho. So, what are those mistakes that you have noticed, and how can they overcome them?
all right. So Prostho as a specialty, it is very technique sensitive and very detail oriented, right? And students often face challenges while learning itself. So the first and the most common problem I feel is again the fundamentals. Many students focus on the advanced procedures while neglecting the basics or the basic concepts like occlusion, simple impression making techniques, and material sciences also. They don't even know what material they are using, what property it has, what to do and what not to do about it. Okay. So in order to avoid that, you should always read and be prepared before any lecture or before going into the clinics, or even if you are a private practitioner, you should always be prepared for the case that you will be doing for say these number of cases that you are going to do today. So just go back to the basics and just have a look at it and be attentive during the discussions also. For students specifically, you need to start asking questions. Okay, that solves a lot of things. And make sure to understand the core principles before actually moving to the complex cases. But that doesn't mean that you should not you should just stick to your textbooks, okay? Because while theoretical knowledge is definitely important or essential, hands-on is the key. Okay, so watching tutorials will actually bridge the gap between your theory as well as your practical hands-on. And for example, it was if I talk about my UG days, it was very difficult for me to understand mandibular movements. Like I used to understand certain parts of it, but at one point of time, I never used to comprehend what the text was saying. So it was very difficult for me to visualize and comprehend. So animations made them very easier for me. So all these resources are right there with us. So it becomes very easy for, comprehend also. And then next could be the hesitation to take up the challenging cases also. So this is something which I observed during my PG days, that due to the fear of making mistakes or the lack of confidence also, so this actually hinders your learning. You have a limited period of time, say 3 years of your residency, and if you start hesitating to make mistakes, you'll never grow, right? So we need to understand that the mistakes are part of the learning curve, right? And seeking feedback from your faculties, from your co-PGs, that's very important. Even your juniors also, we should not feel that our ego should not be triggered if our junior is teaching us something. It should not be like that. It should be a community, a holistic learning experience, right? And then another thing is that the backlogs and the late work, okay, that happens due to improper time management. And prostho, as we know it, say complete dentures or the fixed prosthesis, require a lot of meticulous planning and execution, and it takes a lot of time also. So it is very important for to follow a structured workflow and set deadlines for each step, like how we do it in our PG exams also, na, say 30 minutes for bottom molding, that's it. So you need to start practicing also in that sense. And then another common mistake that we tend to do as students is that not keeping up with the advancements. So some students limit themselves to what is taught in the college and fail to explore the new materials altogether, or even the new techniques which are coming up. So the best way to avoid that is by attending workshops, by attending webinars and following research journals and leveraging the online resources for their use. And one last thing can be, if someone asked me to go back in time and to change one thing I did wrong as a student, be it UG or a MDS student, that would be to incorporate magnification in my practice. And if you love yourself and if you don't want an early retirement from your specialty or from your practice, just switch to magnification. Start with basic loops, basic magnification, and you'll definitely thank me later for that.
Okay, ma'am, I really love the learning attitude in you. I mean, that is commendable. And also the fact that you normalized it, it's okay to make mistakes, and that's how you grow in this journey. So, Dr. Neha, another question that I really wanted to ask you is how to stay updated with all the advancements in procedures and research work. Because in our field, it is really important to be updated in order to be with the current generation and also know about the future prospects. So what is your take on that?
See, we as doctors, as well as it's said for the lawyers as well, that we are always practicing till the end of our career, right? So it's very important to be in that constantly learning phase. And the moment you stop that, or you stop keeping up with the latest things, you'll be nowhere or you'll be stagnant. Okay, so it's crucial, definitely, it's crucial to stay updated with the latest trends, be it in material sciences, techniques, workflow, machinery, etc. Okay, if I talk about myself, social media is one of the quickest and the simplest way to stay updated, and following a lot of key opinion leaders, dental educators, and there are so many amazing prostho communities and on Instagram, Facebook, LinkedIn, etc., which gives real-time insights into the current trends and everything. And I'm an ardent follower of Dr. Varun Acharya, and I have been following Dr. Moez Khakiani from since 2019 probably, and ever since he has joined Instagram. He posts anything, and I'm probably the first one to like that post. And then there is Dr. Michael Gregory, whose content has helped me a lot during my uh, PG residency and all the removable denture impression making cases and all. So I regularly visit to their constant, and they share valuable hacks and superb cases on their respective platforms. And apart from that, I've recently joined study groups also. One of them is by ITI. You must be aware of it. So ITI study clubs are basically, they are situated all across the globe for different countries. They have different study clubs. Even in India, most of the states have their own study clubs or things like that. So they constantly or they regularly organize workshops and CD programs, etc., for you to keep up with the latest trends. Especially in it's related to strawman, so mostly the cases are related to implantology. And in fact, I have subscribed to a lot of newsletters and blogs as well. And few of my favorite ones are, one of them is by Dr. Rupert Monkhouse, and there is one by the name Implant Ninja. So these newsletters also keep up with the latest things and the latest hacks or latest materials also. And honestly speaking, the best learning happens while I'm working. Okay, so say if I'm doing 5 crown cutting cases, so I'll try to tweak the procedure or do something about it which makes all these 5 cases different from one from another. Okay, say for example, if I'm talking about gingival retraction, so I'll think about, should I go cordless or should I place cord? If I'm placing a cord, should I do a single cord or a double cord technique? Or should I actually go and use the retraction paste for this particular case? So, testing different approaches also keeps us our work, keeps us engaged in our work, and also it pushes me to refine my methods also. So yeah, and definitely the journals like JPD, IJOP, and of course our very own Indian Prosthodontist Society journal, they are also very helpful in that sense. And these conferences and workshops, they are not just for the knowledge gain per se, but they are also very good opportunities to to create a networking. In fact, for the tour also, we never really got any chance to meet anywhere else except for the Prostho conferences or the PG conventions. That's where we, really met and bonded well. And similarly, there are so many online courses and webinars. If somebody wants to learn, say, a particular skills, then you should definitely stay up to date by following these online courses and webinar also. So these are all my go-to things that I follow to stay updated and relevant in the current world.
Okay, doctor, you have listed out so many avenues, and I really agree on the fact that, networking and conferences, it actually helps you to stay updated and make really great connections. And yeah, you also mentioned so many of my favorite creators that I constantly watch. So I guess a lot of people, they get inspired with their content, and this is what keeps us going in our profession, just put your content, share your things, and inspire others, as well as get inspired by all that.
Yes. Yeah, absolutely.
So, Dr. Neha, now getting on to the last question, and that is, what advice do you have for someone who is going through their prosthodontics journey or doing MDS in prosthodontics? What can they really take care of in their journey?
See, Dr. Ichita, Prostho is one of the most versatile and exciting specialty, and let's be very honest about it, it's very demanding as well. Okay, so I'll not say that only the good part is there for Prostho. There are other things also that somebody has to take into consideration before actually diving into the PG or their journey as a Prostho residency. So the most important thing for them is to understand that as a Prostho PG, or if you are somebody who is looking to take Prostho as a specialty, you need to understand that your day is not gonna end when the usual college OPD gets over. Okay, so probably it actually starts after that, right? So it's basically because of the lab work, which is huge, okay, and it's a very important part of our field. So I would advise the PG students or somebody who's going to pursue prostho as a specialty is that never run away from it. Okay, it will test your patience, and yes, it will definitely take a toll on your health as well. But gradually, you'll need to balance all those things. And once you conquer all those things, and one day you'll be handling everything like a pro. So that's one part of it. And as we have already discussed the various scopes of prostho in India as well as worldwide, and like you said, that every subspecialty of prostho offers a unique career path, be it implantology, cosmetic dentistry, maxillofacial prosthodontist, TMD, sleep apnea, you name it, and it's Prostho is there for you to offer whatever you need to. Okay, and my next advice will definitely be to focus on smart work instead of hard work, because yes, Prostho definitely requires dedication, but it is not just about working aimlessly and endlessly, but it is the efficient work, the amount of efficiency that you are putting in, that really counts. Okay, so next will be for the MDS aspirants. Even for the residents, it is okay to feel lost sometimes. Okay, but staying lost is not okay. You need to pick yourself up one day at a time, or if not so, one case at a time. Okay, so just try to reset and just keep moving forward. And for that, it is very important for you to be surrounded by positive people. Okay, there are a lot of people who will try to pull you down. Just try to identify those elements. They could be anybody. So you need to have a constant source of positivity around you, and just cut all those channels who you think are actually going to pull you down in some way or the other. You don't need that kind of negativity with so much of work around, right? And life after PG is definitely tough. Job market is extremely competitive, and so figure out what will make you stand out from the peers is very important for you to understand during your residency or right before actually take a prostho as a branch. Okay, and it's very important that you start working on your communication skills as well, and also to be a good listener. Okay, and not just communication skills, all sorts of soft skills are going to help you in some way or the other in in your long journey. Okay, so try to better communicate or to establish better communication with your patients. Try to understand what their expectations are, and of course better communication will lead to better trust, and of course the referrals will also speak for themselves. So lastly, I like to repeat it again, that never work for free, no matter what. Okay, this is the best piece of advice that I've ever received from somebody, and I truly abide by it. um, you and your parents have worked really hard to for you to reach here at this particular stage, and your expertise is definitely valuable. So don't let anybody take the advantage of your skills or your expertise for free. Okay, in the initial years that may happen, but don't make it a habit, or don't undervalue yourself. So that's the only piece of advice I have. And lastly, aim to be the best MDS postgraduate and not just another postgraduate. That should be your motto while working on anything.
These are the things that nobody tells you when you're doing post graduation. So I'm so glad that you've made a whole list of the things that one should do, and especially for the fact that don't let someone take advantage of you by giving you like free work and all that. And so I think all the postgraduates who are watching this video, they got a really golden message that this is what you should do in order to make the most of your post graduation days and even after that.
Yes, really.
So, Dr. Neha, with this, we come to the end of this session. and it was so insightful, and you've shared all your knowledge and all the expertise that you had and all your experiences around prosthodontics. So this video will help so many students, and they will look up to you for all the advice and all the guidance that you've given us. So thank you so much for taking out your time, for being here, and to share your knowledge and expertise in everything.
Thank you so much, Dr. Ichita. This was such a great conversation, and a huge thanks to you for having me on board for this. And definitely, you always bring the best conversations to the table, and clearly, you are on a mission to make dentists unstoppable like ever before. And on that note, I'll definitely see you all around, and probably in the next conference, or probably while scrolling the Instagram or somewhere in your feed. So till then, stay curious, stay sharp, and keep raising the bar.
Thank you so much. We'll meet soon. Okay. Okay. Take care, ma'am. Bye bye.
Bye bye.